Welcome to the London Free Press Podcast. I'm your host, Rachel Gilbert. A London doctor has been at the center of a debate on the benefits and or risks of safer opioid supply programs like one here in London. And now Canada's Conservative leader is calling for these types of programs to be defunded and for that money to go towards treatment centers instead. So today I'm talking with London Free Press reporter Randy Richmond all about this very heated debate. Hi, Randy. How are you?
I'm good. How are you?
Good. This debate's reached the national level because it's reached the House of Commons. But let's first start with this article that was in the National Post, kind of criticizing these safer supply programs. Is that right? Can you just briefly explain what the article was about?
Right. The article was written by a National Post columnist, and it took a look at sort of the safer opioid supply programs across the country. And the author concluded that they were a danger, a risk, because he found evidence, in his words, of massive diversion of the opioids that are being provided to people onto the streets. He also found a doctor in London, for example, Dr. Sharon Koivu, who says that this drug that they're offering people through these programs is seems to be causing an increase in infections, especially infections of the spine. So the article was the investigation was quite critical of the safer opioid supply programs. I'm just going to start calling them SOS programs because it's easier than saying
easier to say. Yeah. SOS programs. That's
SOS
okay.
Program.
From now on.
Yeah. So it was quite critical and it got a lot of attention, and it kind of led to this bumping the whole debate about it, which had been brewing for a while in different parts of the country, bumping right up to the national level.
Dr. Andrea Sereda was kind of at the center of this debate because they did quote her in the article too. She is the head of the Safer Opioid Supply Program, or SOS program, at the London Intercommunity Health Center that they have here. So she helps oversee the program that we have here. And she, of course, is a supporter of it. Can you explain how the program works? Because addicts do get their drugs from these programs.
Right. And the doctor, she actually sort of started the program here in London with just 3 or 4 homeless sex workers, street-level sex workers, trying to see if providing them with a safer drug could help their health. So how it works is if you are a person who uses drugs in London, and most times these people inject the drugs as well, and that could be any kind of opioid, fentanyl or hydromorphone, things like that. And some of them are also crystal meth users as well, which is a stimulant. So you go to this program and you get prescribed through the doctor Dilaudid pills, and that's an opioid. So, and it's a hydromorphone. The Dilaudid is a brand name.
Okay.
So the idea behind it is, instead of going to the street to get your drugs, which can be cut with any number of dangerous substances and at any level of the drug you think you're taking, you go here and you get a safe pharmaceutical supply of these drugs, so that it's, theoretically safer for your system. At the same time, because you're seeing a doctor regularly, probably for the first time in many, many years, you're also getting help with other problems that have happened to you because you lived on the street, from infections to hepatitis C, liver damage, the whole range of things you can imagine people get while they're living and sleeping rough.
Sure.
So because that kind of a double effect, it gives you a safer drug, therefore the name, and it gives you health care and also counseling and social services wrapped around it. So that's the idea behind the program. And now it's up to about 300 people in London taking it on the program. And there's other programs like this across Canada too.
Okay. Is there, like, how do I say this? I assume when addicts go here, it's very non-judgmental, right? So would it be fair to say that it's fairly easy for them to get access to this and for them to want to go to these programs?
I don't know if it's fairly easy to get into the program. There's a huge waiting list, or there was when it was studied on last year. There's a waiting list. People want to get on, and there's only so much room. Once you're in, yes, you do have access to the pills. They come in the pill form. Many people will take it away. So you don't get the pills there. You get the prescription there. You go to a pharmacist. You get the pills there. You can take them home and inject them. So it's that part is, relatively accessible, but you do have to go through a regular urine tests. And Dr. Serrata says every time you show up, you do a test. And that's to show that the drug is actually in your system. They want this Dilaudid, the hydromorphone, to be in your system. That way, you're not selling it on the street. That's a proof you're actually taking it. So
Right.
there are conditions. But yes, it is non-judgmental. It's part of that whole range of harm reduction. Started off with methadone clinics, where you get a kind of an opioid replacement therapy, they call it. Then Suboxone clinics. That was kind of the first level. Then along came safe consumption sites where you bring your own drugs to a site and you use safely. And now this is kind of the third next level where they actually prescribe you the drugs to take.
Right. So this doesn't necessarily help with the addiction part or to solve or to treat the addiction part, but to help with other issues that the addicts may have, right? And keep them safer in other ways.
Yeah, exactly. And it's to keep them out of hospital, to keep them out of police harm, out of jail, to make their overall health better. So that then if they want, they can start weaning off. They can do whatever they want. They can go to treatment. They can stay on the hydromorphone forever because it's keeping them healthy. So it's up to them. It's kind of that when you talk about non-judgmental, it's definitely that way. Is you are not forced to do anything. While you're there, though, you can get counseling for the trauma or abuse that you've suffered causes some of the drug use. So there's the whole range of options for people, but it's basically up to the individual to determine what they want and when.
Sure. There are, of course, a lot of critics of these types of sites, and there have been over the years, as you mentioned. There have been many iterations of these kinds of supports, and when we often hear the criticism, it's often because of things like NIMBYism. People are against them generally. That NIMBYism, I don't want that near my house. I don't want these sites near my school. I think they cause more harm than good. And now there's criticism that these addicts are selling their pills to other people on the street to make money, including children. So what has some of the criticisms been recently of these SOS sites?
Well, yeah, the criticism has been sort of based on the diversion. So people taking the pills they get and then selling them to others or selling them on the street, selling them to dealers. There's this whole stories. There are these stories about, basically dealers crowding around these safe supply programs to get the drugs from people. I mean, the stories are going that there's flooding the schoolyards with it, that sort of thing. There hasn't been any sort of empirical evidence of that. There's been some anecdotes of that. Some police forces have said, no, it's not happening. Some users who use the program say, yes, they are. I've talked to some who say, no, they aren't. So it's one of those stories out there. I'm not sure if it's true or not. It's that kind of view of it can sometimes be touched by that. Sometimes not. Sometimes it's just community safety and people really worried. Sometimes it's touched with that moral view of drug use where people just don't want to help addicted people because they don't like that they're addicted. In other words, it's your fault.
Sure.
It's your fault you're addicted. So there's a moral judgment there.
Right.
And the other criticism is in the infections. Now that's, something that probably could be easier. Well, easier. I'm not a scientist. Easier for medical people to show at some point statistically whether or not infections have gone up. There's kind of competing stats locally about this, whether infections have gone up, and it's whether it be when you crush a pill like Dilaudid or any pill and you inject it, there can be particles that can get into your system and cause infections somehow. So that's kind of the fear there, is that the amount of Dilaudid being put on to people is causing infections.
Right.
So those are the two criticisms, and kind of the counter to that is, and that moral judgment again is, anti-harm reduction is give them treatment, make them abstinent, don't feed their addiction. So the story goes.
Right.
There's people on both sides of this argument who insist that that it's not an either or. Like there's moderates on both sides of this saying it's not either treatment or abstinence or harm reduction. It should be arranged for everybody. But right now it's kind of that old thing about, pull yourself up by your bootstraps and get yourself better, and we're going to cut you off until you get better.
Yeah, figure this out yourself.
Exactly.
Sure. So what do the supporters of these programs like Dr. Sereda say to selling the drugs, especially to children? You say there's no empirical evidence of that we know of. People are saying it anecdotally, but we don't know that. And generally the criticism that these clinics do more harm than good. What do the supporters say to kind of rebut that?
Well, the first thing the supporters do is point to studies, like actual scientific studies, that show that there's been a lot of good caused by these programs. There was a study done by the London SOS program that took about, I think it was like 50 to 80 people who were in the program, and compared them with 50 to 80 similar people, same ages, also drug users, who weren't in the program. And it was like a control group and a study group. And they found that the people who've been in the program went to emergency rooms a lot less often, had fewer infections, had less involvement with police, much more sort of healthier lifestyles than those who are not in the program. There's been other studies where people sort of self-reported their progress, and they're reporting, the patients themselves are reporting that they're having less involvement, less crime. Some are reporting that they're actually starting to go off using drugs totally. Many are saying they're stopped injecting. So that's the kind of statistical or the studies that that supporters have said. Opponents have countered, saying your studies are not accurate, or they're not done properly, and that's a whole area I don't want to get into. But
Sure.
When you start criticizing people's research, so. And the supporters also say there's no proof of diversion, and Dr. Sereda in London says that there's no way she stands by her patients, saying they're not going to sell the kids. She calls that the boogeyman story, which is again a sign of the moral judgment. I think we've seen this in every so-called drug wave that's come along. It's hitting our school kids, right? Crack cocaine back in the schoolyard. Everything. There's always a story that's hitting the school kids. And
that's right. And as you mentioned, at the London program, they have a urine test every day to make sure that these patients are taking the drugs that they're given, right? So they're not, so that they can't. And if they are found to not have the drug in their system, are they kicked out of the program? Do you know of any consequences for that?
Well, the consequences are that you now have to take that drug in front of a pharmacist. So you don't get to take it home and do what you want with it. If you keep showing up with no hydromorphone in your urine, you're going to have to be taking that hydromorphone pill right in front of the pharmacist. So
there are safeguards in place, at least here with the London program, to make sure that selling this drug doesn't happen.
Right. And the supporters of it say if there is diversion happening, there'll be some diversion, because some people are desperate. These people are homeless, a lot of them. So, a pill that can get you money for food or for a room over your head for the night, you might sell. It's understandable. So, but there's ways you can sort of keep a lid on that rather than throw out the whole program, supporters say.
Sure. So federal conservative leader Pierre Poilievre caught on to this National Post article and introduced a motion in the House of Commons calling for an end to safe supply programs across the country, and saying that instead we should fund more treatment centers and not have these safe supply programs. And so what has been the support for that motion so far?
Well, he won't, of course, get that through the House, because the NDP and the Liberal, and I think the Bloc as well, they're all in favor of safer supply programs. So it's more of a political statement, grandstanding, if you will, or just to get his party separate from the others to say this. It's not going to go through the House. Supporters of the program say it could cause some harm. It'll keep people from the program. Opponents of the program say it's about time, that the money shouldn't be going to this. Resources are scarce. It should be going to treatment programs. Again, supporters say it shouldn't be either or. There should be treatment. We all know we need more treatment programs, especially in London. We could, Safer Supply does what it's doing. other programs are doing what they're doing. So, people need a range of programs to get through, or to live in a healthier way when they're using drugs. So that's sort of the argument there. So I don't think, it will go anywhere. It might sell well on the campaign trail. I mean, all parties up for things to make them stand out, and maybe this is one with, right. People are afraid of getting afraid of their cities again, rightly or wrongly, because there is such the opioid crisis is so large. So maybe it's a great political stance for them to take.
Sure. What if we had program? What if the supporters, like Dr. Serratis said about this? What if we did cut off supply programs and forced people into treatment? Can we force people into treatment? Would that actually help to fund treatment centers?
Forcing treatment has never helped a certain percentage of people. I mean, I've talked to, I don't know, dozens and dozens and dozens of people who've injected drugs over the years, and they're all different, but there's no way. They've tried treatment, they've tried methadone, Suboxone. It's worked for some things work for others, but forcing treatment or forcing abstinence before treatment just doesn't work. You're not dealing with what got you to this place of using drugs. You're not dealing with the fact that you don't have a home to live in, or a house or shelter, that you're not healthy. I mean, I don't know how you can expect most people to suddenly stop using drugs when it's the drugs that are helping them cope with the horrible things they've gone through and the horrible things they're going through.
Right.
I can't.
It's a complex issue, and
it is. Yeah. I mean, I'm not going to give up coffee every morning because it makes me go. So,
right. Yeah.
So don't tell. I mean, we all have coping mechanisms. Some come with greater risks.
Sure.
We all individually have to gauge, assess those risks to ourselves. But it's sad that my addictions to coffee, for example, just because it doesn't lead me to physical harm necessarily, like I'm not being judged for it. Whereas people who have physical harm because their addictions are being judged for it. So there, I don't think it would work. Not from the people I've talked to. It just won't work if you just force people.
Sure. Well, we'll certainly watch your stories on this, because I'm sure there's going to be more to come on this, as this is now a national debate. Again, I mean, these issues and these kinds of sites have been talked about for years and years, obviously, and the debate seems to be the same, but we will definitely watch your stories on this. Randy, thank you so much for joining us today.
You're welcome. Thank you.